Hello, I'm Ross McDonald and I'm here today with Jamie Gray, Director of the Distributed eLibrary at Weill Cornell Medicine-Qatar. The eLibrary is the organising force behind the Evolving Health Information Landscape Symposium to be held on the 2nd of December 2021 in Doha, and I'm here to learn more about it. Jamie Gray, thanks for coming along.
Well, thank you so much for having me.
So the symposium title refers to the Evolving Health Information Landscape. Can you tell us more about this?
Sure. So the idea of the symposium is really related to how rapidly the information landscape is changing and how influential these changes are, in particular in relation to health information. So the pandemic has really highlighted how considerations around quality, access, interpretation, and application of health-related information can have impacts at both the individual and population level. And so it's a very timely conversation for us to have, I think.
The Distributed eLibrary, it's the academic medical library that serves Weill Cornell Medicine-Qatar. What was the motivation behind organising this conference for the library?
So the motivation was really to try and bring together a diverse group of interprofessionals to think about the challenges and opportunities around the current information ecosystem. And we wanted to be able to discuss kind of these important intersections, so thinking about not only what gets published, but also how it gets translated for different audiences to consume, and really think about that from a holistic point of view.
Sure. What are some of the topics we'll hear about?
So there's really three major themes that we'll be exploring on the day. The first is looking at changes in scientific publishing. So thinking about the move to open, the shift to having more emphasis on synthesis-style publications showing up in journals. We'll then also be thinking about navigation of health information. So really considering things like findability, user-seeking behaviors when they need information, where do they go? And then finally, the last theme is looking at the role of libraries as health communicators. So we wanted to explore kind of what is the role for us in terms of helping to bridge the gap, translating what's in the scientific research and making that applicable, say, at a policy level, or thinking about what health literacy conversations might look like.
Sure. What do you see as potential major landmarks on the future of health information?
That's a great question. So I really think all three of the areas that the symposium is exploring are going to be important factors going forward. Personally, I'm probably most excited by the idea of health libraries beginning to explore ways that we can look at blending what I think has been more of our traditional role in scholarly communications and bringing that together with complementary fields like science and health communication. I see a lot of potential synergy there that could be applied at a personal level, so thinking about conversations that happen one-on-one in healthcare encounters, or even considering that from a population level. So, for example, working with our public health colleagues to craft effective health messages and work on the dissemination strategies for that. So I really think there's going to be a lot of great opportunities to explore around potential collaborations across disciplines, agencies, kind of going forward, and hopefully really help move the needle on conversations we've been having for a while and are very important to us professionally.
That sounds very interesting. Jamie Gray, thank you very much.
Oh, thank you.